Brooklyn Independent Television.
For a pregnant woman, there are a number of health issues to be aware of: what she eats, smoking and drinking, staying fit, and so on. There are also medical issues, some of which she has no control over. One of these, especially among African American women, is a growth in the uterus called a fibroid. How much of a risk do uterine fibroids pose? How do doctors deal with them? Healthbeat's Jenny Passe Rodriguez introduces us to a Brooklyn specialist in the subject and a woman who knows about the problem firsthand.
Hello? May I speak to Takai, please?
After a long day of working as a high school guidance counselor, 38-year-old Jennifer Almanor looks forward to playing with her 1-year-old daughter. But for 16 years, the married Crown Heights native suffered from benign tumors of the uterus, a condition commonly known as uterine fibroids. On top of heavy and prolonged bleeding during her periods, she experienced frequent urination, spotting in between periods, and an enlarged uterus as big as if it were already in its 22nd week of pregnancy. But a fear of going under the knife prevented her from having the 4 fibroids removed.
Give Mommy a kiss.
2 years ago, Jennifer was forced to put her fears aside because she wanted to start having children.
I love you. I was scared naturally, but I, read and did my research and I had asked questions. So I was pretty, together and understood what I had to do and what to expect from having the procedure done. And, 2 years later, I have a daughter.
Jennifer underwent a procedure called a myomectomy, one of the more common ways to remove fibroids.
It was the year I had went to a convention, so just a few weeks later, I was traveling. So I was fine. Just took it easy, and try to do as little as possible because you have to treat it as if you're having a C-section. No bending, no lifting.
Based at Long Island College Hospital's Department of Obstetrics and Gynecology, Dr. Millicent Comrie is one of Brooklyn's leading experts in the treatments of fibroids. She says while women like Jennifer have several options when it comes to treatments, those who plan on having children may want to consider a more invasive procedure.
The most comprehensive way of removing all your fibroids in a hands-on way is the abdominal myomectomy, which is my preferred way of removing the fibroids. Why? Because at that time, I go in, I remove all the fibroids, I palpate, meaning feel the uterus, feel for the little ones. Small fibroids become bigger fibroids 2 to 3 years when the woman is now ready to have a baby.
Some fibroids grow on top of the uterus. Others grow on stalks outside of the uterus. Fibroids that grow along the cavity of the uterus can be especially problematic. These fibroids can prevent implantation of the embryo, causing a miscarriage. And when a woman is pregnant and suffers from fibroids, delivery can be compromised.
One of the big problems with fibroids, if it's located near the opening of the uterus, near the cervix, it can block the exit of the baby at the time of delivery. So these women have to have cesarean section.
As common as fibroids are, they're still something of a mystery. But doctors do know who's more likely to get them.
We don't know what really causes fibroids, but one thing we know is that it's very prevalent in the Black African American community. And we know that there's a genetic link because commonly a patient who comes here, she'll tell you, my mom has fibroids or had fibroids, my sister.
Say, Mommy.
In fact, African American women are 2 to 3 times more likely to be diagnosed with fibroids, and at a younger age, than women in any other group. Though Jennifer was one of those statistics, now 3 months pregnant with her second child, she advises women not to wait as long as she did to seek treatment, and to get a second opinion if you have doubts about your diagnosis.
Say 1.
For Healthbeat Brooklyn, I'm Jenny Passe Rodriguez.
Brooklyn Independent Television on the BCAT TV network.